Welcoming patients who do their own research is common practice for some providers.
I actually am not bothered by the fact that it's entirely possible that my patient may know more about their disease than I do. I think we need to really work on that really hard to try to make sure that people can take classes.
Dr. Mark Roberts is the chairman of the Department of Health Policy and Management at the University of Pittsburgh's Graduate School of Public Health.
I'm also a practicing internist over at the medical school. I see general internal medicine patients, and I do a combination of teaching, patient care, and research.
He is working with some colleagues on that, and he's going to...
I only see patients part-time now, but back when I was much more of a full-time clinician, and I would see 40 or 50 patients in a week, and they would have 30 or 40 different, or 50 or 60 different problems, I can only know what I know about those from my training and from what I choose to look up at night and things like that in the research I tend to do and keep up with. One of those patients may only have one disease that they care about, and they spend hours and hours and hours and days and days and days researching that. And so in terms of factual knowledge, I gave up a long time ago the notion that I know more than my patient does about every aspect of their disease. Where we can partner, though, is that the patient has no context or no framework on which to hang that knowledge. And I have that. I have broad understanding of physiology and broad understanding of pathophysiology. I understand disease processes. I understand therapeutic interventions and how they work and how they don't work. And I understand, I'd like to believe I understand, the interconnections between various different components of the body and disease and non-disease. And so I view some of those things as more a partnership with that person or that patient who has been spending weeks and weeks and weeks researching and reading far more than I ever have on that particular disease, that I can help them place that information in the context of science, in the context of what they can expect, and how that information may or may not be true for their particular situation.